practice. Hello everybody, my name is Asia Smith. I'm a senior psychology student here at North Carolina Central University, and this is my final research presentation for my undergrad thesis class, and throughout this course I was known as the solo research fellow. So before we begin, I do want to talk about my research question, which was, does yoga improve body image in young adult women? And to explore these topics before we could go to the literature review, the methodology, and the research I have conducted, I do want to talk about how I defined yoga throughout this research process. So yoga was known as the mind and practice that fosters physical and psychological spiritual well-being through breathing techniques, posture, meditation, and ethical principles. Body image, on the other hand, was described as how individuals thought of themselves and the cognitive and behavior components that impacted their evaluation of their physical appearance. So when we look at our research on yoga, we see that there was 2 points that I really found in most of my studies, which is that yoga do help reduce stress and anxiety, and it does have an effect on the brain and the body. So when we look back at reducing stress and anxiety, we see that individuals with anxiety disorder were more likely to show improvement in emotional regulation after performing yoga. When we did looking at the study with the ICU nurses, we saw that since ICU nurses seem to be a high stress occupation, they seem to have reduced their stress after going through the yoga experience. And then lastly, looking at caregivers, who are also experienced much stress, especially I think this research study was looking at how caregivers who are taking care of students or children with disabilities seem to be more stressed. And after doing the yoga, they were experiencing having lower stress and improvement in their well-being. I also saw that yoga do affect the brain and the body. So through the physiological improvement, we saw that yoga did help improve the cardiovascular functions and cardiovascular functions and the stress regulations. When we look at the EEG study, they did show that there was an increase in alpha wave activity in the brain when the individual was performing yoga. And alpha wave activity is linked to relaxation and cognitive functions. And then lastly, looking at emotional regulation and well-being, we saw that yoga do work. We saw that it did help regulate emotions better and seemed more happier after doing the yoga. So overall, these yoga studies have proved to be have a lot more benefits compared to traditional exercise. When we look at body image, I saw that self-esteem played a big role in shaping body image as well as social environments. So when we look at self-esteem, we saw individuals with low self-esteem were more vulnerable to negative influence, like criticism and comparison, which leads us to the next point of media exposure. So people who are already having low self-esteem, they tend to take more negative comments to heart because of how they're not very more confident within themselves. And then that leads us to our third point about self-worth and physical appearance. They tend to have a high self-comparison linked more to their positive body image. So when they look at other people posts and other peers and see they getting more likes and comments in them, they tend to back away and be like, what am I not doing right? And they start feeling more insecure with themselves. So then when we look at the social and cultural influence, we see that the cultural norms tend to discourage certain body types, and even in some cultures, they do have expectations of athletes. So they do expect to see a certain body type within their children. And going back to the social media point, social media also often promotes unrealistic beauty standards, which is not good for people who already have low self-esteem, and just seeing that, oh, these people, this is the beauty standard, this is how you should present yourself, and that person's not doing it, it leads to lowering their self-esteem even more. And then lastly, the increase in social comparison and cultural pressure. We have seen in a longitudinal study that the pressure builds over time and reduce self-esteem, so not improving it, especially when it coming from family members or friends. And then lastly is my research on yoga and body image. 2 points I found is that they increase in body awareness as well as promoting self-love. So in a yoga practice study, they showed that individuals became more aware with their body, how their body feel, and their body function. We see that mindfulness practice did help individuals accept bodily changes. And then when we look at the multi-body and cancer patients, after taking that assessment, we did see that patient cancer patients did see a shift in attention from the external appearance and more to the internal awareness. When we look at yoga, and we also see that the relationship between yoga and body image, they do help promote self-love, and that is by encouraging compassion connections with the body, so function and appreciability, which help individuals to value themselves, their bodily functions, rather than how it appears. We also did see an increase in body satisfaction and a decrease in eating behavior in an eating behavior study that did see if, like, okay, if you did yoga, how would you feel about eating more or less. And then in the increase of self-comparison, we did see like a decrease in eating disorder symptoms. So we saw individuals are less likely to have eating disorder behavior. So the study that I did replicate was Ariel and Friends. 2019, does yoga improve body image in young adults? In that study, she has 75 young adult women participants, which are between the ages of 18 and 30. They found their volunteers do flyers, college systems, or university announcements, but most of their participants was more college students. To measure it, they did look at the pre and post tests of their yoga and control group. And to collect this data, they did use a self-report using the multidimensional body self-relations questionnaire appearance scale. And right here, we do see their we see how the data analysis that they conducted, and we saw they did look at more of the how people evaluate their appearance, how they view their body satisfaction, their body orientation, and then that was it. That was the 3 points they really looked at, and they looked at it before the study started and then after the study started, and they compare it between the groups and see the difference of the change over time. For my methodology that I performed or did this research this semester was I did 40 participants, all female. Most of my recruits were advertisements, which was through social media. To measure it, we looked at the pre and post test between the experimental and control group. And to collect this data, we did use the multidimensional body self-relation questionnaire appearance scale, and we did conduct a 12-week study. So when I looked at my descriptive data, most of the people that perform, we have 57.5% that really identify themselves as female. Everybody else was considered female in the study, but at birth they did have a different gender assignment role. We saw that 65.2% was mostly students at the university or at a university or college. Most of our demographic was African American, and then the most age that we saw was people who was about 19 to 20 years old that was participated in this study. So, for my inferential statistics, we conducted a t-test so we could be able to compare the pre and post test of the multi-dimensional body scale or relation questionnaire. And the results showed that the post-test scores were more significantly higher than the pre-test scores, which suggests that body satisfaction was improved overall. So then